Yes, it's on the screen. Doris is asking, please, what would cause the spleen to swell and retain blood? What can be done about it?
Okay, Doris. Yes, I know this question. Yes, you see, in children with sickle cell disease, we've always said that spleen doesn't work well. The spleen doesn't get adequate blood supply, so it gets sort of shrunk. It gets shrunk or it gets dissolved in children with sickle cell disease. But how do some children get swollen spleen? That is a mystery, right? So in the parts of the world where malaria is quite endemic, malaria is a disease that tends to affect something called blood tubes, tiny blood tubes, especially inside the organs such as liver and spleen. Okay, so malaria tends to swell up the liver and spleen whenever there is an infection with malaria. In those places where malaria is endemic or where there is a continuous presence of malaria without any seasonal variation, then the spleen and the liver, they are constantly exposed to the malaria the malaria germ, right? It's a germ. So when these children have repeated exposures to malaria germ, then the spleen starts enlarging or becoming swollen. And what happens is, when there's an acute trigger, we spoke about triggers earlier, when there is an acute trigger and there is a rapid sickling and rapid breaking down of the blood cells into the spleen, then the spleen thinks, oh, this is the right time for me to work more. So it starts trapping every cell. We call it as hypersplenism. When there is a lot of cells trapped inside the spleen, that is when these children tend to have low blood levels, suddenly enlarged spleen, painful spleen. And in children less than 5 years, from 2 to 5 years, they can even have something like a life-threatening emergency called splenic sequestration. So that is why when we diagnose a child with sickle cell disease, we always teach the parents or the caregivers how to palpate the spleen if there is any sudden enlargement on the spleen side. We always teach them how to palpate for spleen.
So what can be done about it? That's the second part of the question. We understand how the spleen swells. It swells in children who live in malaria places where there's a lot of malaria, because for most children the spleen just dissolves, as you said.
Yes.
Most children with sickle cell disease, the spleen dissolves, but in some children with sickle cell disease, especially those who live where there's a lot of malaria, the spleen can get swollen, and then the spleen is so happy and it wants to work so much it collects all the blood into itself. But what can be done about it?
So number one is malaria prophylaxis. So make sure, when I say prophylaxis, it means prevention of episodes of malaria. Make sure there is no water stagnation around the residents, and make sure children, especially children and vulnerable people like pregnant people, sleep under insecticide-treated net. Make sure that your windows are netted with malaria against mosquitoes. And when there is malaria, suspicion of malaria, get treated well. Complete the treatment so that there is no incomplete treatment of malaria. And also, there are some disease-modifying agents that have been found to be useful in children, so that the episodes of sickling, the spontaneous sickling, are reduced. So one of those disease-modifying agents that has been approved in children is hydroxyurea.
Okay, that's the question. That is the question that was asked. I was just waiting for the right time to show it. By Benny V. Derry. It says that the question is on hydroxyurea. What exactly does hydroxyurea do in sickle cell disease?
Yeah. Okay, so so as we all know, babies do not manifest the symptoms of sickle cell disease. For a person to even show that, for a child to even show the symptoms of sickle cell disease, it takes 4 to 6 months of time, after birth. This is because of a protective hemoglobin or protective component in the blood called baby hemoglobin or fetal hemoglobin. Okay, so because of the persistence of this fetal hemoglobin up to the age of 4 to 6 months, that is protective, and the babies do not manifest any of the symptoms of sickle cell disease. But once this fetal hemoglobin starts dropping down from 4 to 6 months, that's when they tend to have swollen hand and feet, and then bone pains, low blood, poor growth, and so on. So what hydroxyurea does is that it causes something like a genetic switch. It's instead of making the blood cells produce more, making of the blood cells produce more hemoglobin, adult hemoglobin, it causes sort of a genetic switch so that there is more production of baby hemoglobin or fetal hemoglobin. So remember, when the fetal hemoglobin was very high up to the age of 4 to 6 months, the babies did not have any manifestations because that baby hemoglobin doesn't allow the cells to sickle. It's sort of protected. It's like how mummies are around, babies are very happy with them. They don't allow, when small children are with mummies, nobody can bully them. The same way, when baby hemoglobin or the fetal hemoglobin is inside the red blood cell, they don't sickle easily. So hydroxyurea, by causing a genetic switch, it helps to increase the fetal hemoglobin and doesn't allow the cell to become sickle. That's number one. Number two is it improves the shape of the red blood cell so that it can flow freely and there is no reduction in the oxygen carrying ability of the blood cell, so that the body parts that are supplied by the blood tube, they don't get any pain, the children grow well, and all that. So hydroxyurea has been found to be really helpful in helping the children from not getting those crises, called as crises, especially in those children who are newly diagnosed with sickle cell disease. And also children who have been on hydroxyurea. Currently we have almost 1,300 thereabout children on hydroxyurea currently in our pediatric sickle cell disease clinic at College Teaching Hospital.